Today, we're diving into a revolution that feels like it's straight out of science fiction, but it's happening right now in our hospitals and clinics. We're talking about the fusion of artificial intelligence and healthcare. And no, this isn't about robot doctors taking over. It's about a really fundamental shift in how we find, fight, and even prevent disease. So let's get right into it.
Let's just start with one number that really frames this whole conversation: 40%. Just let that sink in for a second. That's the potential boost in diagnostic accuracy that AI can bring to the table. I mean, think about radiology. That could mean catching a cancerous tumor weeks, maybe even months, earlier than we could before, right when treatment is going to be most effective.
And you know, this isn't just a clinical revolution. It's a massive financial one too. This new era of medicine is being driven by an incredible economic engine, one that's literally reshaping the entire healthcare industry from the ground up.
So how big are we talking? Well, the projected economic impact of AI in medicine is, get this, a staggering $411 billion. This isn't just about investing in a few new gadgets, it's about a complete restructuring of the industry, all driven by the promise of better efficiency, unbelievable accuracy, and truly personal care.
So what's actually powering this whole transformation? Well, it really comes down to a brand new toolkit for doctors, a set of core AI technologies that are absolutely changing the game. Let's pop the hood and see what makes all of this work.
First up is machine learning. Okay, the best way to think about it is like a medical student who has somehow read every single textbook, every patient file, and every clinical trial that has ever existed. It learns from this just massive sea of data to spot these super subtle patterns that a human could never see, helping doctors make smarter, data-driven decisions.
And building on that, you have deep learning. This is a more advanced version of machine learning that's an absolute master of visual recognition. This is the tech that lets an AI see inside really complex medical images, like X-rays and MRIs, and spot tiny little abnormalities that even a trained human eye might miss.
Next up, we have natural language processing, or what you'll hear called NLP. This is the part of AI that actually understands us, human language. It can scan decades of unstructured doctor's notes in just a few seconds to flag at-risk patients, or it can power the chatbots that help you manage your own health. It's all about bridging that communication gap. And finally, all of this comes together in computer vision. This is basically where deep learning gets its eyes. It's the specific tool that gives AI its diagnostic superpower, allowing it to tear through those medical images with incredible speed and accuracy to help identify diseases. Okay, so we've got the tools. Now for the exciting part. Let's see how they all come together out in the real world, in the clinic, in the operating room, and ultimately how this tech is really impacting patients like you and me. It really all starts with diagnostics. You can think of AI as a second set of expert eyes for doctors. It scans and analyzes data, looking not just for the obvious problems, but for microscopic patterns, like the tiny subtle changes in a scan of your retina that could actually predict your risk of a heart attack years in the future. And the results? They can be absolutely stunning. In some cancer assessments, AI systems have proven to be, and I'm quoting here, almost twice as accurate as a biopsy. Just think about that. A non-invasive analysis is outperforming a surgical procedure. That is a true game changer. And what this all means is a dramatic drop in mistakes. We're talking about roughly a 30% reduction in diagnostic errors. For patients, that means everything. It means getting the right diagnosis and the right treatment right from the very start. But AI's impact goes way beyond just getting the diagnosis right. It's kicking off the era of truly personalized medicine. I mean, just imagine a treatment plan that starts with your unique genetic code, then it pulls in health data from your medical history and maybe even your smartwatch, and then it considers your lifestyle. The end result? A therapy that's optimized specifically for you, not just for your condition. And by creating this complete, holistic picture of a patient, AI can actually predict the risk of developing certain conditions with 50% more precision. This is a fundamental change in how we do healthcare. We're moving from just reacting to sickness to proactively keeping you well. And yep, AI is even making its way into the sterile environment of the operating room. These AI-guided robotic systems, with their incredibly steady hands and superhuman precision, are making our best surgeons even better. They allow for smaller incisions, less trauma to the body, and much faster recovery times. They aren't replacing surgeons, they're empowering them.
Now, all of this incredible power raises some equally important questions. This technology is a game changer, for sure, but we have to be really thoughtful and really deliberate about how we use it.
So let's talk about the crucial challenges we need to navigate to do this responsibly.
There are really 4 key areas we absolutely have to get right. First, we need to make sure the AI is trained on diverse data to avoid algorithmic bias, so it works for everyone. We have to guarantee total data privacy to protect our most sensitive information. This next one is critical. We always need a human in the loop, a doctor who makes the final call. And finally, we need clear rules of the road, solid regulatory frameworks for using this tech safely.
And this right here is the absolute core principle. Let me be super clear. The goal of AI in medicine is not to replace our amazing doctors, nurses, and specialists. It's to empower them, to give them tools that can see more, process more, and ultimately help them provide the best care imaginable. So, if we can put those essential guardrails in place, where do we go from here? I mean, the pace of innovation is just getting faster and faster, and the future of our health is becoming even more tied to this technology.
Looking ahead, we can expect diagnostics to get even more sophisticated, with AI pulling together imaging, genetics, and clinical data into one single analysis. Surgical systems are going to get smarter, providing real-time guidance to surgeons. And, maybe most importantly, AI has the potential to bring expert medical knowledge to remote and underserved corners of the world.
So let's just quickly recap the incredible progress. We're seeing a 40% improvement in diagnostics, a 30% boost in how efficient our treatments are, and a 50% jump in our ability to detect diseases early. As you can see on the chart, these aren't just numbers on a screen. They represent longer, healthier lives for real people.
There is no doubt that AI is opening up a brand new frontier in human health, offering possibilities we could only dream of just a decade ago. The tech is here, and the potential is crystal clear. So the real question isn't if we'll cross this frontier, but how we'll choose to shape it for the good of all of us.